Welcome to this session on nasal. The specific learning objectives of today's session are to describe the boundaries of the nasal cavity, to trace the blood supply and nerve supply of the nasal cavity, and to clinically correlate the anatomy of the nasal. The subdivisions of the nasal cavity. The nasal cavity is divided into three parts: the vestibule, the olfactory region, and the respiratory region. The vestibule is the anteroinferior part of the nasal cavity. It is the part of the nasal cavity which is the dilated part of the nasal cavity lying immediately inside the anterior nasal aperture. Now this vestibule, this green shaded area, is lined by skin, and it has number of hair follicles and hair structures, tuft like hair structures, which are called vibrissae. And then we have the olfactory region, which occupies the upper one-third of the nasal cavity, right? And then we have the respiratory region here, which occupies the lower two-third of the nasal cavity. So this is how the nasal cavity is divided into three parts: the vestibule, the olfactory region, and the respiratory region. Olfactory region, as you know, is concerned with smell. The boundaries of the nasal cavity. Now, each half of the nasal cavity is pyramidal in shape, right? Now, what you're seeing here is the sagittal view of the nasal cavity, right? And here, if you see, this structure here is the roof of the nasal cavity, and the structure below here, this forms the floor of the nasal cavity. And then, now what you're seeing here is the medial wall. Now the medial wall is also the nasal septum, right? And then you also have the lateral wall. Now the lateral wall is not showed in this view because this section is taken exactly in the midline, right? Do you follow? Next, coming to the floor. So yeah, so this is the floor here. So the floor is made up of two bones. Anteriorly you have the palatine process of the maxilla, and posteriorly there is this horizontal plate of the palatine bone. So these two bones make up. Next, coming to the roof. Now the roof has an anterior part here, a central part, and behind that is the posterior part. So the anterior part is made up of the frontal and the nasal bones, right? The central part is made up of the cribriform plate of the ethmoid bone. Why is it called cribriform? Because it has number of sieve-like pores in it. So that's why it's called cribriform plate. And then the posterior most part, this is called the body of the sphenoid. Now what you're seeing here is the sphenoidal air sinus, right? This cavity here is called sphenoidal air sinus, and this cavity here is the frontal air sinus. So this is the frontal bone, this is the nasal bone, this is the cribriform plate of ethmoid, and this is the body of the sphenoid within which lies the sphenoidal air sinus. Now next comes the medial wall of the nose. Now this medial wall of the nose is also called the nasal septum. Now it has a bony part and it has a cartilaginous part as well. Now the bony part is made up of the perpendicular plate of ethmoid. So this postero-superior part is what is called the perpendicular plate of ethmoid, and postero-inferiorly it is made up of vomer. Vomer is a part of the sphenoid bone, right? So vomer, the perpendicular plate of ethmoid, and then this is the cartilaginous part here, which is made up of septal cartilage, right? And the septal processes of two major alar cartilage. So these constitute the cartilaginous part. Now this is, as I just told you, that the nasal cavity is pyramidal in shape, right? So these are two pyramidal structures here, and this is the nasal septum. So the septal process of the two alar cartilages are united to form a structure called the columella, right? This is the mobile part of the nasal septum. And sometimes the nasal septum is deviated to one side, and it can cause sinusitis, it can cause repeated infections, or it can cause breathing difficulties, right? So if it is affecting one's health, then it has to be corrected. by septoplasty. Next, coming to the lateral wall of the nose. Now this lateral wall of the nose has, you can describe it as having a posterior part, a middle part, and the anterior part. So this part here is the posterior part, and then you have the middle part, and then you have the anterior part. So if you see this posterior part, you have a number of shelf-like projections, right? So these shelf-like bony projections are called concha, and they are also called turbinates. So you have a superior concha, a middle concha, and an inferior concha. And this middle part, right, in front of the middle meatus is what is called, this depression here is what is called the atrium of the middle meatus, right? And then, as I told you, the anterior inferior most part of the nasal cavity is what is called the vestibule. Now, this atrium is guarded above by it is limited above by a ridge. This ridge here is what is called the agar nasi, right? So this ridge, it limits the upper part of the atrium of the middle meatus. And then you also have something called the lemon nasi. Then what is this lemon nasi? This is a mucocutaneous ridge which separates the vestibule and the atrium of the middle meatus. Now why is it mucocutaneous? Because the vestibule is lined by skin, whereas the rest of the nasal cavity is lined by mucosa. So that is why this junction here is called mucocutaneous junction. It's a mucocutaneous ridge. So remember, lemon nasi is a mucocutaneous ridge separating the vestibule from the atrium of the middle meatus, whereas agar nasi is a ridge which forms the upper limit of the atrium of the middle meatus, right? There are a number of structures which open up into the lateral wall of the nose, especially the paranasal air sinuses, right? So these paranasal air sinuses are spaces which are found within the skull. So these paranasal air sinuses, they open in the lateral wall of the nose. So where it opens is what is important. So first of all, you need to know what a meatus is. So you know what a concha is. Concha are bony shelf-like projections, right? So the space below and lateral to each concha is what is called a meatus, right? For example, now this is the inferior concha, so you have the inferior meatus below it. This is the middle concha, you have the middle meatus below it, right? And then you also have the superior concha and you have the superior meatus below it. So these are spaces which are found below and lateral to each concha. Now in the middle meatus, you have a number of important landmarks in which you need to remember. Now you can see an elevation here. This elevation is what is called the bulla ethmoidalis. Now why is this elevation produced? It is produced because of the underlying middle ethmoidal air sinus. Right, you have the ethmoidal air sinus is divided into anterior, middle, and posterior. So it is the middle ethmoidal air sinus which is present underneath, and that is why you have this elevation. And then you have something called the hiatus semilunaris. This hiatus semilunaris is a cleft which is present immediately below the bulla ethmoidalis, right? And then you have something called the infundibulum. What is this infundibulum? This hiatus semilunaris, it expands anteriorly into a funnel-shaped structure. So this funnel-shaped structure is what is called the infundibulum. And then you also have something called the sphenoethmoidal recess. Now this sphenoethmoidal recess is a triangle depression which is present above and behind the superior concha. Right, so this is the superior concha. So remember, sphenoethmoid recess is present above the superior concha, whereas the superior meatus lies below the superior concha. So now coming to the openings in the lateral wall of the nose. So remember, this sphenoethmoidal recess now presents the opening of the sphenoidal air sinus. So this is the sphenoidal air sinus which opens into the sphenoethmoidal recess. And then in the superior meatus lies the opening of the posterior ethmoidal air sinus. So remember, the posterior ethmoidal air sinus opens in the superior meatus. And then coming to the middle meatus. Now in the middle meatus, I told you there is this swelling which is called bulla ethmoidalis, and on it opens the middle ethmoidal air sinus. The opening of the middle ethmoidal air sinus is present over the bulla ethmoidalis. And then in the hiatus semilunaris, you have the opening of three paranasal air sinus. From anterior to posterior, you have the frontal air sinus, the anterior ethmoidal air sinus, and the maxillary air sinus. Now you have, this is the frontal air sinus. You can see the frontal air sinus coming and opening into the anterior part of the hiatus semilunaris. And to be just remind you once again, the anterior part of the hiatus semilunaris is only expanded to form the infundibulum. So you can also say that the frontal air sinus is present in the infundibulum of the hiatus semilunaris. And then in the middle part lies the opening of the anterior ethmoidal air sinus, and in the posterior part of the hiatus semilunaris lies the opening of the maxillary air sinus. And please also note that in the inferior meatus lies the opening of the nasolacrimal duct, and this opening of the nasolacrimal duct is guarded by the Heisner's valve. Now coming to the arterial supply of the nasal septum. The nasal septum is supplied by branches of ophthalmic artery, maxillary artery, and facial artery. So the branches of ophthalmic artery which supply the nasal septum are anterior ethmoidal and posterior ethmoidal arteries. And the branches of the maxillary artery which supply the nasal septum are the sphenopalatine artery and the greater palatine artery. Right? And also the superior labial branch of the facial artery also supplies. Now there is a very important area in the nasal septum which is called Little's area. Right? It's present in the antero-inferior part of the nasal septum, and this is an area where all these vessels, they come and anastomose with each other, especially the anterior ethmoidal, the sphenopalatine, the greater palatine, and also the superior labial arteries. Now this plexus which forms here is called the Kieselbach's plexus. And why is this important? It's important because now it is an area which has the potential for bleeding. Okay, so bleeding through the nose is called epistaxis, right? So whenever there is bleeding through the ears, ideally you need to apply pressure over the right. And then coming to the arterial supply of the lateral wall of the nose. And the arterial supply of the lateral wall of the nose, you divide the lateral wall of the nose into four quadrants, right? This is the antero-superior quadrant, this is the antero-inferior quadrant, this is the postero-superior quadrant, and this is the postero-inferior quadrant. And you need to know which artery supplies which quadrant of the nasal lateral wall of nose. The antero-superior quadrant is supplied by the anterior ethmoidal artery, which is a branch of the ophthalmic artery. The antero-inferior quadrant is supplied by branches of the facial artery and as well as branches of the greater palatine artery. The posterior-superior quadrant is supplied by the sphenopalatine artery, which is a branch of maxillary artery. And the posterior-inferior quadrant is supplied by the branches of greater palatine artery. And regarding the venous drainage of the nasal cavity, all these veins, they form a plexus beneath the mucosa, and finally they drain into the facial vein, and they either the pterygoid plexus or the pharyngeal plexus of veins. Posterior inferior quadrant is supplied by nasopalatine or the long. Here, do remember that it is supplied by the greater palatine nerve, which is again a branch of the pterygopalatine ganglion. This is it. So thank you all for your patient listening, and do post your doubts if any. Thank you.